Here's what they don't teach you in school about isometrics. What's going on, guys? My name is Andreas Soltis, and I'm a physical therapist, and I'm going to show you the differences of isometric training when it comes to not only hypertrophy, but specifically for low back pain, neck pain, shoulder pain, any kind of pain you can think of. Isometrics is by far the most safest form of strength training because you're really not moving. Plus, it also shows a lot of benefits when it comes to pain modulation. It just depends what type of isometric that you're doing and also for how long. So we're going to demonstrate here with an actual live model so we can see the differences between two different isometrics. One of them is called yielding isometrics. The other one is called overcoming isometrics. You probably had yourself some clients yourselves or patients yourselves or even yourself that you may be experiencing, let's say, Achilles pain or low back pain, and you've been doing isometrics, let's say 3 times a day for 4 weeks, and you're still at square one. There's really no improvement. Well, that's not the appropriate thing to do. The most appropriate thing to take into consideration is what type of isometric, for how long, and how intense it should be. When it comes to isometrics, I tend to use this a lot in my practice because it's just the safest form of strength training and provides some type of security to people that they don't feel that they got to be fearful of moving. Again, when it comes to isometrics, we're just going to look at 2 main big ones. And if you haven't really seen a change, that means either your nervous system just didn't like that specific isometric. Because when you guys are looking at isometrics, a lot of therapists and chiropractors, physicians, and personal trainers, they'll look at isometrics as a form of a load for a tendon, which indeed that is true. But before it even goes to the tendon, it has to change the nervous system. I tend to look at how does the nervous system respond to isometrics and what kind of isometrics. So we're going to demonstrate here. You guys are going to see that if I do a yielding isometric, it's going to give me a different response as opposed to an overcoming isometric, right? So please take into consideration that when you're doing isometric training, you always want to assess and reassess to see which one gave you the best benefit, not only in minimizing pain, but also the one that increased your range of motion, as well as your performance. You feel like you can engage muscles a lot better as opposed to other forms of isometrics, because there are other forms as well. We also have ballistic isometrics. We also have isometrics with perturbations. There's so many different forms, but I'm going to show you the very 2 basic ones today to see how that impacts the nervous system. All right, guys, now let's do a little bit of a live demo to show you how we can do overcoming versus yielding isometrics. I'm going to call up my athlete here. We're going to have Laura. Thank you very much for coming. So Laura here, phenomenal shape, as you can see. 3-time world swimming champion. Been working with Laura for quite some time for her lower back, even though it's a lot better now, thank God. We're just trying to do some maintenance stuff. But today we're going to take a look at her range of motion. Even though she may not be complaining of pain for lower back, we'll see about that. We're going to check out some basic range of motion stuff, and then we're going to implement isometrics to see how well her nervous system, specifically her brain, does her brain like overcoming or does it like yielding isometrics? Let's see side bending of the trunk. And that's to the right, to the left. Yeah, so when she bends to the right, she feels that little tugging on the left side of her lower back. Let's check neck, side bending. I'm not just looking at only the lower back, I'm looking at almost everything, but I'm going to check out her neck. Tightness on the right side when she bends left. So head rotations. And I'm seeing a limitation to her right. And now let's check out trunk rotations. We'll turn from this view. And let's just see how far you can go to that left, kind of facing the camera there. And both kind of restricted. I would say the left to look a little bit more restricted. Yeah. So her left was more restricted as opposed to her right. So now I'm going to give her a isometric. I'm going to give her a rotational isometric. For Laura's case, if I want to attack the low back, I'm probably going to give her an isometric for her to resist me against leftward rotation. The muscles that are involved here is left erector, right abdominals. Those are the muscle groups that rotate the trunk left. And let's do this facing this way. All right. So what I'm gonna ask for Laura is just to have knees lightly bent just so you can keep her stability. And she's gonna have her arms out kind of like a pal-off press. So now the difference between a yielding isometric and an overcoming isometric is my verbal command. So I'm gonna resist her into leftward isometric. So we're gonna start from here. You ready? Mm-hmm. Start it, push me. And now my command for yielding isometrics is don't let me beat you. Come on, don't let me beat you. Don't let me beat you. 5, 4, 3, 2, 1. Very good. So my verbal command was don't let me beat you, which becomes kind of like a isometric eccentric type of contraction, right? Let's see what that just did. Let's see side bending of the trunk. That was better? All right. How did the neck feel now? Looks like you got more rotation to the right. There. That's much better there. And let's check out those trunk rotations now. That's to the left. And you guys can see how farther that went, as well as the right. So her range of motion improved, and now she doesn't feel the pain on her left side. That's pretty awesome. Let's see what happens if we do overcoming isometrics. And now my verbal command is going to be push, and now beat me. Keep pushing me, try and beat me, try and beat me. Come on, and rest. Beautiful. All right, let's see side bends of the trunk again. And that does not look good. Let's see head rotations, and that got worse. Oh, and that immediately got tight on her neck. Let's see those trunk twists. Still kind of, but did that feel smooth? She got tighter on this side though. So overcoming isometrics may not be appropriate for her. So we're gonna focus on yielding isometrics. Now when it comes to how can I do this on my own? Well, if you want to practice yielding isometrics, you're gonna use a resistance band, quite heavy, and just hold it in a pal-off press if it's rotation that you wanna focus on. The band has give. It wants to pull you to the opposite side, but you're trying to maintain that position. So a band might be appropriate for yielding isometrics. For overcoming, you would then use an isometric strap, right? There's no give, so you just have to constantly mentally rehearse in your brain, keep beating the strap, keep pushing. Versus the band, you have to make sure that the band doesn't beat you. That's the only difference. There's also a difference on how long and how much load to apply to an isometric. Long hold isometrics. Long hold means you're holding an isometric contraction anywhere between 3 to 5 minutes. That's how long it takes. But the load is no more than 40 to 50% of your max effort. That has been the one to show the greatest benefit to decreasing pain and, ready for this, decrease your blood pressure. So that was my little demonstration on the 2 different types of isometrics. Obviously, there's a lot more when it comes to this, but just know that please be specific on what type of isometric you're doing. The only way to know is maybe have somebody test it for you with their hands. Try an isometric for 20 seconds just holding a band. Then reassess, see how your back feels. Then grab an isometric strap and now do an overcoming isometric for another 30 seconds. And if you got stiffer or if you got way better, that is the type of isometric you should be focusing on. So this was the 2 types of isometrics that I like to debunk for a lot of people. Hopefully this was helpful, and this is exactly the kind of stuff that I show in my NeuMove mentorship program. If you're very interested in it, take a look below at the link below, and I'll see you guys there. Thank you very much. Now, if you haven't watched this video, I highly recommend that you do, because I do explain a lot of very useful information and practical tools that you can use. So you definitely don't want to miss this out. Watch this next video, and I'll see you guys there.